Good evening, everyone. Uh, Welcome to our today's show, Cha Halkhabar. How are you? And our today's event will be in English. And today I have very special guest, who is the most respected person of my life also, and who is my mentor, and who actually inspired me to dedicate my life in mental health. And today's guest is Vikram Patel, and who is the Percy Square Professor of Global Health at Harvard Medical School. And he has multiple hats. If I introduce him, it will take more than 15 minutes. So I will quickly give you such introduction of Vikram. Vikram is a Wellcome Trust Principal Research Fellow. He is professor in the Department of Global Health and Population at Harvard T.S. Chan School of Public Health. He is co-founder and member of Managing Committee Sangath Guha. He is honorary professor at London School of Hygiene and Tropical Medicine. And the Vikram is a true global leader who has been dedicating his whole life to bring mental health issues of low and middle income countries into global platform. His contribution is remarkable to push mental health agenda as part of global public health discourse. There are thousands of people globally like me, whom Vikram is an inspiration. And thank you, Vikram, for joining me today to discuss mental health issues. And it's my privilege today to have you in my show, Cha Halkhabar. So it means, how are you? And actually, I developed this show during the lockdown. And my intention is to inspire people to use the social media platform and to reach out their friends, family, and even like the neighbors to ask how they are doing in the difficult time. So by accident, it developed as a regular Facebook show, which I invite people from different areas of life and spend like an hour sharing our personal lived experiences of our diverse profession. So welcome, Vikram.
Thank you so much, Jagannath. It's always a great pleasure to talk to you, even though in these times we have to talk to each other in this kind of way. At least we're getting a chance to speak to each other, and I look forward also to this conversation and maybe hopefully the next one in person in Kathmandu.
Definitely. So how are you?
Well, it's been a now 3 months of the lockdown, and it's a very surreal time actually, Jagannath. It's an unreal moment in my life, and indeed, I probably an unreal moment in everyone's life. 3 months ago, the government announced what some people consider the most stringent lockdown in the world. It was on March the 25th. I remember it very well because I was sitting in front of the television with my family watching the Prime Minister announce it. And we were told then that within a month or 2 months at the most, by middle of May, the epidemic would be over. Now here we are
Wow.
in July, and the epidemic is screeching out of control across the country. The economy is in a tailspin, and as a result, the government has had to lift the lockdown because it has no choice now, because otherwise the economy would be fatally injured. And here we are watching this incredible, unreal situation of the epidemic becoming worse by the day as the government has no choice but to lift the lockdown. This should have been the time when the lockdown was actually imposed, but instead we're having to lift it. And so it is a very surreal time. And as a scientist, I experience this in two levels. As a scientist, I am absolutely bewildered and baffled by what is happening in India. And as a human being, I feel very sad and very worried for so many of my fellow Indian citizens who are facing such an uncertain future.
I think you were locked down in India, yes?
No, actually, I'm not. I'm locked down in India. What happened was I was about to leave for the US in early March to start teaching in my the second half of the spring semester, and Harvard University shut down. So Harvard University actually shut down
Okay.
before India shut down, and we were forbidden to travel. At that time, India had very few cases, and it was very clear that the US was heading in a very bad direction in terms of the surge of cases. And so I was instructed actually not to get on a plane and come to Boston, which was at that time one of the worst affected cities in the US. On the other hand, I was in Delhi where there were very few cases. And so I decided to stay back because, the city was under lockdown, the medical school was shut, and all the students were asked to leave the campus. And basically, since
Okay.
then, the situation in the US has gotten worse. The situation in India has gotten worse. So both countries are in a pretty bad situation when it comes to the epidemic.
Okay. So can you like adjust your volume? There is a comment. It's a little bit low. Okay, I think
Is that any better?
yeah, it's better. Yeah. So how are you spending your days in Goa? I think
Okay,
you are in Goa.
let me just put up the microphone. Is that any better,
Okay.
Jagannath?
Yeah, it's better now. Yeah.
Okay, good. So, I have a very good routine, Jagannath. My
Yeah.
routine typically begins, I always have done this. I wake up always between 6 and 6:30 in the morning. Um, I then actually spend a couple of hours working. Usually my emails from Boston come in overnight because, Boston is about 9.5 hours behind India. I spend 2 to 2.5 hours till about 9 in the morning completing my email. I do some household work. I then go and take my dog for a walk in the village where I live. I come back. I then, on most days a week, I go for a swim. And this is like an exercise swim.
Mm.
On returning from my swim, I read the newspapers, I have lunch with my wife, and then I have an afternoon nap, which I enjoy doing very much. And the reason I have an afternoon nap as well is because then my work actually begins with the Boston team waking up. So the Boston team wakes up at about, for me, about 3:30 in the afternoon, and then I work till about 9:30 at night. I also have work in India, as you know, with Sangath, but actually most of that work has come to a halt because of the lockdown. And so all our teams are basically at home. We're hoping very much in the coming months we'll again slowly restart work, but obviously all our field work has come to a halt.
Okay. Generally, there is a very interesting observation among a global mental health community. Like wherever I travel, others travel, and no matter like in which time zone we live, if we send you an email, you reply within like couple of hours. So there is a rumor that you don't sleep. Is that true?
Actually, that's a great question. You know what? It's a lot of people have told me this, and I have it's a kind of ritual that I have to clear my email inbox in the morning every morning, and I will clear every email I get the previous day. There are occasions when I have emails that are collecting, but those are very rare. They happen like when I'm on holiday. But when I'm on holiday, I have an email. I never check my email. What I do is I have a message saying, "I will not reply to your email, but if the email is still relevant after such and such date, write to me again, and I will reply." So I do sleep, and actually, Jagannath, I love my sleep. I must get at least 8 hours of sleep in a 24-hour cycle. So I usually sleep twice a
Wow.
day. I sleep at night, usually between 6.5 to 7.5 hours, and then in the afternoon for about 45 minutes or so. That's my daily routine.
Okay. I think that's much helpful for everyone.
I actually, I think afternoon sleep is a very, very positive for your mental health. I think it's actually, I think the human sleep wake cycle typically always dips in the early afternoon. And, I do believe that from an evolutionary perspective and from a survival perspective, to have a nap in the afternoon has been very good because it keeps you more alert in the evening. And then, obviously you have a much longer evening. You can be much more engaged with your family when you're having the evening meal. If there are friends, you can be much more involved, because if you didn't sleep in the afternoon, you can be really, really tired in the evening, and it's very hard to then be socially engaged.
So I think I will let me ask you some questions. Lots of people are interested to hear your observation and your advice on mental health, because there are so many uh, terrible news of suicides, and even like uh, there are news during lockdown periods, the suicides rates are rising rapidly. And in the last 3 months, if we look at the suicide trends even in Nepal, the rises are like more than 100%, sometime in 200% also. And I know like mental health issues uh, can't be perceived in isolation, but I want to understand your observation, like how has the COVID-19 pandemic has affected mental health issues in general, public health issues in general, and mental health issues in particular in developing countries, your observation.
So I'll speak mainly from my experience in India. It's my first person
Okay,
experience. And
yeah,
so that's
yeah,
the experience I can feel most confident about. First of all, I have to say, it doesn't matter whether the suicide rates are 10% more, 50% more, 100% more. For me, what matters is that every life counts. And every life that has been lost through suicide because of poorly planned public policies is a suicide that should have been avoided, and that there is an absolute and total responsibility on the government for having failed in its fundamental duty to protect human life, to protect its citizens. And it's even more painful when the human life has been lost because of a particular man-made decision that unthinkingly has robbed human beings of their livelihood, robbed human beings of their security, robbed human beings of their certainty of what lies ahead. And I do believe that governments in India have failed very badly in protecting the sanctity of human life. I think we have failed our poor terribly. There have been harrowing images of millions of workers who have been put out of work overnight. These are in India, and I'm sure Nepal is the same. Large proportions of India's workforce are daily wage laborers. They basically will eat today what they have earned today. And if by having these sudden policies of locking down the entire economy without pausing to think about how will you protect the tens of millions of people who will immediately stop earning money the very next day, and therefore will have no money to feed themselves, their children, or their families. Not even to think about that, not even to prepare the country for that. I think it's a very significant failure of humanity, of compassion, and of governance. Now, you asked me the question about mental health. As you can see, I get very upset by this. Of course, when you see such cruelty and lack of compassion, it affects you. If you have any thinking or emotional bone in your body, to see so many people suffer needlessly, something that could have been completely avoided, it makes you very sad and also very angry. I see the COVID-19 pandemic's impact on mental health in India playing out in two different phases. The first phase is the one we're in right now, which is what I call the pandemic of fear, when it isn't the virus so much which we should fear, but fear itself, which is such a dangerous emotion. And there are very many reasons for that fear. Of course, the biggest reason is uncertainty, Jagannath. The one thing that really preys on our mind is not knowing what tomorrow will bring. Think about it. If you didn't know whether you would actually be able to eat tomorrow, whether you'd have a job tomorrow, whether the world will operate in the same way tomorrow as it does today, it is going to make you very anxious. And that will play on your mind and create a whole range of very distressing emotional experiences. Imagine what is happening right now. I don't think any one of us has ever seen such a huge amount of uncertainty in our lifetime. We have so many uncertainties, and we do not know any longer when the world will return to normal, whatever that normal might be. In such a situation, it is not surprising that people are reacting with anxiety and fear. And I'll tell you another thing that makes it even worse is misinformation. Very poor communication about the virus, very poor communication about the facts on who is at risk, how is the virus transmitted, huge amounts of political disagreements. And this is, of course, not only true in India, it's happened in many other countries. Political leaders and scientists arguing with each other, disagreeing with each other. It makes ordinary citizens who do not understand epidemics, who do not understand epidemiology, very nervous. Who's in charge here? Who knows actually what is going on? And so all of this put together makes the population extremely anxious and nervous. And to me, that's the first phase. But the second phase, in my mind, is much more sinister. And that second phase has begun to emerge and will get worse in the months and years ahead. and that is the pandemic of poverty and loss of hope that is going to affect tens of millions of people in India, and indeed, I think across South Asia. And you know very well, Jagannath, that poverty is an extremely toxic social determinant for mental illness, particularly depression. On top of that, on top of poverty, in India, we also have very huge levels of inequality, which you also know is terrible for the social fabric of society. So you've got poverty, you've got inequality, you've got a mental health care system that could barely reach 5% of the people of this country. I mean, it's a very toxic brew, really. And I fear very much for the rising trends of mental illness, suffering, and suicide in the months and years ahead, unless India does something dramatic in reimagining how mental health care should be delivered.
So do you think, is there any likelihood that a disaster such as COVID-19 would make way for the development of new types of mental health problems
It, ha-
unseen till now?
it has to, Jagannath. Business as usual can continue. Business as usual, like I said before, COVID-19 failed to reach 95% of India's people. You know, just simply putting more money into that system is guaranteed to be a waste of money. I think also business as usual, apart from it being very limited in its reach, was entirely focused on doctors who gave diagnoses, who prescribed drugs, the 3Ds. Of course, that has a role. But as you know well, mental illness is a much more diverse set of human experiences. There's a much more diverse range of ways that we can help people recover from mental illness. And the 3Ds only represent a small part of the overall landscape of mental health care. So for example, the work that Sangath has been doing in India, you know, of training frontline workers to deliver psychological and social interventions. To me, this is the kind of genuine innovation that is science-based, that is affordable, and that is acceptable to the vast majority of India's people, is the kind of additional resource need that we have, is to invest in those sorts of innovative practices.
Okay. Are there any research funding like already started looking at the new symptoms associated with the COVID-19?
There is some new funding, of course there is, but you know, 99 paise out of every rupee is going to the more biological aspects of COVID-19, you know, vaccine research, research for treatment of acute lung problems in COVID-19 and so on. You know, it's very little research money in mental health, very, very little. There is obviously some because, you know, COVID-19 is a new thing, but overall, as a fraction of the total amount of money, it's very small.
Okay. So before the COVID-19 pandemic, like we used to write, even advocate, one is poor people, one like out of four, like 25% people in normal population suffer from mental health issues. So during such situation, what do you think is the scale of impact of the pandemic on mental health and its associated problems?
You know, I don't want to speculate on numbers, Jagannath. Suffice to say,
Okay.
it's going to be a lot more than it used to be. That mental
Yeah.
health problems and suffering is become much more common. The question to us as a society in all of South Asia is what is the government and what is society going to do to address mental health problems? You know, I would say for me, even though I'm a researcher, I have no interest in counting how many people are sick. I think that head counting is something we've been doing for 30, 40 years, and we've got all these dramatic numbers. Now is the time for action. And action means putting into place those kinds of locally acceptable solutions that we know can work and are affordable. And importantly, I want to stress once again, those solutions are not only about the biomedical system, but they're also about the psychosocial support system in the community. They're in fact probably far more important. You know, much of the mental health care work should happen at the base of the pyramid of healthcare. All our money is going at the tip, you know, which is where the specialists sit in their hospitals. We need to continue supporting that, but all the new resources must be to strengthen the primary care and community focused mental health care system.
Have you seen any developing countries playing a proactive role in tackling rising mental health problems
Well,
during this time?
I don't think I know enough about every country in the world. So, I really cannot answer that question across the world. I do know, for example, in India, there are some states that have been doing very well. I mean, the state of Chhattisgarh, for example, has been incorporating many of the ideas that I mentioned to you earlier. For example, they're deploying community health workers who in India called ASHA workers to provide a basic mental health support. So there are a number of parts of the world similarly who are doing as best as they can with the resources they have. And I think the problem is, first of all, there's not enough money going to mental health. What money there is, a lot of it goes to research, which of course, I would should be happy about, because as an academic, I could see some of that money coming my way. But actually, I'm not happy because, I feel much more frustrated that all the research that we have already, the knowledge we have already, we're not doing anything with it. And that's frustrating for a researcher. For me, as a researcher, the ultimate success for me is not how many scientific publications I have, but to what extent is the science that I have created actually being put to use. And so I am much more committed to seeing more money going into implementation rather than just more research. Unfortunately, though, there's not enough money. And secondly, what money there is not necessarily going towards improving access to quality care.
Okay, yeah. Can you little bit elaborate about the work like in India that's with little resource organizations are doing to address
Yeah,
mental health issues?
yeah, definitely.
Because
So,
like people who are struggling to provide services can learn and even like can replicate those models.
So in a very brief form, the single most exciting innovation in global mental health does not come from global mental health. It comes from global health. And that
Okay.
innovation is the use of community health workers to deliver healthcare interventions for prevention and treatment of health problems with very specific training to deliver very specific interventions, what's called task sharing. And this has been a proven strategy for all kinds of health issues. For example, improving maternal health and child health. And I'm very inspired by that. And all I did was to copy that particular approach and apply it to the mental health arena. And now we know, after 15 years of experiments and pilot projects in many parts of the world, in Africa, in South Asia, in Latin America, and so on, that it is not only very acceptable to patient populations, to communities, to have community health workers from their own community who speak their own language, who dress the same way, who understand the metaphors, the culture of the people. It is much more acceptable for them to receive psychological and social interventions from those providers. But also, Jagannath, this is the real magic, it's also very effective. And because these kinds of providers are plentiful, you often hear the usual complaint is, we don't have enough in countries like India and Nepal. We don't have enough psychiatrists. We don't have enough psychologists. We don't have enough psychiatric nurses. We should turn that around and say, but we do have enough people. We have enough people in our communities who want to help other people. And what we need to do is to invest in the science that we know that can help these people learn skills that make them community-based mental health care providers. We need to invest in ordinary people. And then, of course, we need to resource, for example, through honoraria or stipends, so that you also create jobs, Jagannath. That's the incredible thing, right? We have this enormous situation here, a crisis where we're seeing massive joblessness, unemployment. And on the other hand, we have enormous unmet needs for mental health care. And there is a science showing that you can take the unemployed, train them, and provide mental health care. And so to me, the moment for task sharing could not be better, because you can deal with both issues simultaneously and at a relatively very small additional investment.
I totally agree with you, and it's a very new term also for me. Like we have enough people, and people are the greatest resource to help to each other during the difficult time, even like to provide mental health support.
Correct.
So how could we mobilize them? Like what do they need, and how could they make themselves prepared to help other?
Well, I think the important thing is that we do need leadership from the state here, because this kind of scale up program is audacious. It requires very good leadership. It requires some technical capacity, right? I mean, I make it sound simple, but there is a whole method that one has to follow, right? It is no question that there is a science behind scaling up, and one has to understand that science, and for that you need to have leadership that is willing to embrace this kind of new idea, leadership that is willing to invest in it, and that is what every government needs to do. Now, what we do in India, Sangath, as a technical support agency, works with the governments, the state governments, to build capacity in the system for that leadership, as well as to provide the government with the necessary tools to scale up these evidence-based approaches in their healthcare system. For example, we have this new program called Empower, which is building digital tools that health workers can use on their smartphones to learn and deliver these psychological treatments, which means you can train literally millions of health workers within a space of a few months, because all the training is sitting on your phone. And then you can also supervise them and enable them to deliver treatments also on your digital platforms. Now, that's a new initiative. It's audacious, and we're just started work on this about 6 months ago. And so this is the kind of role that an NGO can play. An NGO that has the right implementation science capacity to work in partnership with the government, and that's what we're trying to do in India.
Okay, so I'm interested, like, to know how are you dealing with the stigma in India while implementing your program among healthcare professionals and among like the general public also?
So several different strategies. First of all, I believe very strongly in the lived experience as being at the heart of anti-stigma campaigns. For too long, people have spoken about people with mental illness. For too long, you had experts like me talk about the need for compassion, the need for investment, etc. That does not work. What we need is people with a lived experience who say, I have had mental illness. This was my experience. This is my suffering. This is who I am as a person. And now here's my story of recovery. This is how I recovered, and this is how I feel today. This is the kind of storytelling, the storytelling of the lived experience that we use a lot. We have this initiative called It's Okay to Talk, which is a national network, both online and offline. It's the word says it all. The name of the initiative, It's Okay to Talk, which is focusing on young people to tell their stories about experiences of mental health. So that's one very important initiative. The second important initiative is to actually demedicalize, where possible, conversations around mental illness. Because, the old ideas of mental illness are very strongly influenced by colonial psychiatry. Let's not forget, we keep thinking that people just have negative attitudes because they have, no understanding of mental illness. That's not true. People get these negative attitudes from somewhere. And where do they get it from? They get it from the mental hospital. The mental hospital was a place you sent somebody never to see them again. If you sent them to the mental hospital, you would probably never see them again. And if you did see them again, they would be completely a different person, very sedated, totally doped out, like a zombie. Now, when you went to see them at the mental hospital, it would be like a zoo, even worse than a zoo. People behind cages, behind bars, oftentimes naked, screaming at each other, poorly cared for. This is the image of a hospital. Now, if that is what a hospital is, you can imagine why stigma and fear is associated with mental illness. So a second very important part of our work is to create community-based alternatives. And I talked about that a little earlier, so that most mental health care can be delivered in the community, at home or in primary care, without the need to go to a mental hospital at all. And I hope very much that as we go forward in time in South Asia, all mental hospitals will be transformed so that they can become centers of learning. They can be open places. There are no walls, no doors, no locks. Just like any other hospital, there is only the standard security. And that these can be places of higher learning for training the next generation of mental health professionals, rather than places to lock people away from society.
Okay. In India, like Deepika Padukone's campaign is celebrated internationally. How you views celebrities' involvement in mental health to fight the stigma?
I think it's terrific. I think it's terrific that she's involved. She's a very prominent and a very widely liked actress in the country. And she has championed a few causes, one of which is mental health. I think it has had a very positive impact on public attitudes. There is only one caveat I will always say when celebrities talk about mental health is that we must be careful not to allow the myth that mental illness is a celebrity problem to take hold. Okay, because what happens is people sometimes go and say, oh, these are the problems of rich and beautiful people, but actually the truth is that mental illnesses are much common amongst poor and disadvantaged and marginalized people. But I don't think that is the celebrity's responsibility. I just think that we need to have a more balanced conversation in the public arena, in the media, so that if people think this is just a celebrity problem, that we're clearly dismissing and saying, no, 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 this is just a celebrity who has described her experience, and we should be very, very appreciative of that. But the truth is that mental illness affects people across the social strata.
Yeah, that's true. And in Nepal, you also highlighted the same like inequality problem in India also. In Nepal, suicide among women is a serious issue. How can we address this gendered component of the crisis? I think your advice will be helpful for both India and Nepal and other developing countries also.
So as with any mental health issue, Jagannath, we need to act at two levels. We must act at the level of social determinants, in this case, patriarchy. It's a poisonous influence in the whole of South Asia. Every country in the region is affected by patriarchy. Patriarchy is damaging, very damaging to women's well-being, but it's also damaging to men, because it's not in men's interest to have to live in a family where there are very poor relationships between men and women. It's in no one's interest. But of course, women suffer the worst due to domestic violence, denial of opportunities, and so on. So one has to combat patriarchy, and by combating patriarchy, it's not just a legal combat. It's about starting very early in life, from schools, educating young children, both boys and girls, about the fundamental nature of equality of boys and girls. There is absolutely no difference in any respect between boys and girls in terms of their capabilities and the life opportunities that they should actually deserve and enjoy. But the second level is at the level of the individual. It's no good just talking about social determinants. If you've got a woman who is living in a violent relationship and is depressed and suicidal, you still have to help her. So I would never see this as either or. We have to work on both tracks, at the level of society as well as at the level of the individual who is depressed and living in a violent relationship, providing her with direct assistance, for example, for her depression, for example, for her violent relationship, providing her with maybe a shelter, legal advice, and if possible, engaging with the man in order to try and get him to change his behavior. So those are the two levels at which we work. I work at both levels, to be quite honest, because I'm involved both in policy making and I'm very, very passionate about working on issues with gender inequity. But I also work very much at clinical level, working with women who are victims of violence to help them cope with the violence better, to help them recover from depression if they are depressed, and to actually help them navigate to women's support groups that can give them more specific advice on how to deal with the violence and ultimately, perhaps if needed, to escape from the violence.
Okay, so let me raise the issues of non-communicable disease also, because since the starting of the virus, in countries like Nepal, people who are already struggling with the non-communicable disease, they are the victims of ignorance, and the state is focusing on COVID-19, and till now, most of the general public health services are shut down. So what if we ignore non-communicable disease, how it may affect the mental health issues of those people?
So first of all, Jagannath, I have to say you really touched on a very important subject that is a great concern to me, that the lockdown actually might do more harm in terms of health than the virus itself. And one of the ways it might do so is by blocking access to essential healthcare services for people with any other health condition, including mental illness, by the way, but also many other conditions that are potentially
Yeah.
very deadly, like cancer, heart disease, and so on. And already we're seeing evidence of that, Jagannath. We're seeing, for example, the numbers of women coming to hospital for delivery drop. And you know that hospital deliveries are the safest delivery options for childbirth. We're seeing the numbers of children being immunized drop. We're seeing all kinds of the surgical and medical OPDs showing dramatic reductions in numbers. So, people haven't suddenly gotten better of all their diseases. It's very obvious that they've stopped coming to hospital because of the lockdown, because of fear. And what that will mean for additional mortality because of this disease, only time will tell. But it is a huge worry. Now, of course, you asked me a question about how does the increased burden of physical health problems affect mental health. You know very well that physical health and mental health are like this. You cannot separate them, even though medicine separates them into psychiatry and medicine. That's rubbish. Actually, our minds and our bodies are completely and totally intertwined with one another. When our body is diseased, our mind feels unwell. And when our mind is unwell, our body gets sick. And so it's obvious that a poorer control of non-communicable diseases, particularly things like diabetes and cardiovascular disease and cancer, will almost certainly also make the mental health of those individuals much worse.
So, Vikram, I would like to know your message to the communities, NGOs, and even development agencies also, like who are confused in this difficult time, though they have like the real good intention to provide mental health services.
So to the communities, what I would say most importantly is look within your own communities for the resources that every community has, which can help people who are having mental health difficulties and crises recover. Look within your own communities for the kinds of ways in which you can collectively, with solidarity, address the social factors that make mental health, everyone's mental health worse. For example, if you know that there are certain subgroups in the community who face discrimination, now is the time to actually make inclusion a reality for them. For example, people with disabilities, people who belong to certain religious or other ethnic minority groups. Now is the time to reach out to them, to show compassion and humanity. And I'll tell you what, Jagannath, you're not doing charity when you do that. It's important not to see being compassionate and reaching out to others who are distressed in your communities as charity. It is doing service to yourself. Because one of the most landmark studies that Harvard has ever done has been to demonstrate it's actually the longest running health study in history, which has been running for now almost 100 years, in which a group of health workers, all men, were followed up over time, and then their children were followed up, and so on. So it's an intergenerational study.
Is
And
that still going on?
it is still going on. Yeah.
Oh.
Basically, the study was asking the question, what predicts a healthy life, a long life and a healthy life? And of course, you think tobacco, alcohol, these are important predictors, and of course they are. But you know what the leading factors that predicted a healthy life were? It was the number of friends you had, your social network, and secondly, the service you did in your community, the kinds of activities you were doing that were for other people in your community. So make no mistake, when you help others, you're not doing charity. You might be doing charity, but the main reason you're doing it is because it's really good for yourself. So think about that when you are in the community. I think for people who are at the level of investors, the government, please be following the science. We need more money, but spend it wisely. It's not just more money, but also how and what you spend it on. And I think there is no better investment than spending it on task sharing, properly designed, carefully selected psychological and social interventions through community health workers, peer support workers, and so on. Because you will reach, for every rupee you invest, you will reach far more people when you invest at the base of the pyramid at the community level than if you invest in hospitals.
Okay. So it's further like this advice will be important for the communities and the individuals. But
Correct.
if I ask you like three suggestion, three advice to the government, like Nepal government or India government, what would be those three advices?
Well, the
They
first
should,
thing,
they
yeah.
must do, they must do like in this difficult time.
Well, the first thing is to immediately invest in the scaling up of psychological interventions for crisis counseling, depression, anxiety, and drinking problems using the evidence-based treatments that have already been developed. They exist, they're free, they're open access. And for that, you have to invest in the training and the supervision of frontline workers. Secondly, to invest in the setting up of small acute care units in all the district hospitals of Nepal, because obviously it is the case that some individuals with very serious acute problems do need to be sheltered in a hospital, but not in a mental hospital. I would strongly recommend that that investment takes place in general hospitals. Thirdly, in every district of Nepal, there should be a care home, a kind of a shelter for long-term care, which is in the community, not in a walled compound, in the community for people with long-standing, enduring mental health problems who are otherwise going to be homeless or who would die out of neglect. So these are people often very chronic intellectual disability and so on, where the staffing is not a medical staffing, but much more a kind of a nursing support or nursing assistance who can help with the activities of daily living. Now, this is in the treatment and recovery area. I also want to say one more thing that people should do in prevention, and that is to strengthen the environments for young children. They're out of school right now. It's so very important to start schools as soon as you can, because schools are a place where young children don't only come to read and learn subjects, but they also come to socialize, and that socialization process is very important for mental health. Sitting at home the whole day also exposes children to very angry and tired and upset parents. And I think we really do need to work very aggressively and quickly to help children return to the normal social environments that are so essential for their mental development.
Do you think like we'll be able to open schools in the next few months?
I hope so. I hope so. If I was in charge, I would open schools. Absolutely. I do know there are risks, but we have to balance risk, Jagannath. We don't live in a perfect world. This is not a mathematical formula that you're living through. Every action has unintended consequences. And we live in a very poor part of the world where there are no safety nets. For example, in America, you can say you can sit at home and study because everyone has the internet. So kids can actually be automatically put in front of a computer. Schools and all the government is pumping so much money into remote learning materials that are very high quality. Children can still go to local parks even during a lockdown and play with other kids. That is not true in India, not true in Nepal. Most kids are growing up at home without any internet, without even electricity. They're basically not getting any education at all. Their parents are hungry. They're sitting at home getting more and more frustrated. This is a totally different social context. You cannot take solutions that work in America and Western Europe and assume you can just piggyback them into our part of the world without recognizing the extremely different social circumstances of people's lives. And I believe that we have made a huge fundamental mistake in trying to copy the West and put the same kind of solutions into our part of the world without acknowledging the fundamental differences between the West and South Asia.
So you think there is more psychological cost for closing schools rather than if we open up quickly?
Absolutely. There's a huge cost to the learning, the all-round psychosocial development of children when you shut down schools in this manner. At least you can make that up a little bit by having remote teaching and other activities. But in South Asia, maybe 7 out of 10 children will never be able to access those. And those are the poorest children of the poorest families in the poorest parts of the country, and they are going to suffer the most.
So it will increase more inequality.
Exactly.
In the long run.
Exactly. The lockdowns will worsen inequality enormously in a part of the world that is already one of the most unequal on the planet. And that is what makes me so very worried about the future of the future well-being of the young people of this country.
Okay, there is one question from Vidushi. She is also listening our conversation. And if we are thinking of policy level intervention that could be rolled out quickly in a relatively small country like Nepal, is there an immediate solution?
For what? For what subject?
Uh, 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 like policy level intervention,
Yeah, but
what
policy
we could do,
for mental health.
like for mental health.
Well, I think it's what I said earlier, right? I mean, deploying community health workers in a evidence-based way to deliver interventions for promoting early life nurturing environments, for example, at home, supporting parents. That's a really great example of preventative intervention. Visiting parents at home who have young children who are not in school to find out how they're doing. What are their learning needs? How can parents be empowered and enabled to provide for the learning needs of their children, not just leaving them on their own? These are parents who are also very often having to work. These are parents who are living literally day by day. So to support the poorest families, the poorest communities through parenting support, and of course the other important thing is I've already mentioned is to support community health workers providing treatments for depression, anxiety, and so on.
Okay, Vikram, we cover like so many things, but
Yeah, we have.
before we end the conversation, I would like to ask you like to share anything like what you are obsessed a lot during the lockdown, what you are like worried.
I'll tell you, Jagannath,
Yeah.
right now I'm very calm. Okay, I'm in a very good place. But about 2 months
Okay.
ago, I was very sad and I was extremely angry. I was extremely angry that I lived in a country where we could treat such a huge number of our people like they were slaves, like they were essentially just simply, yeah, it is slaves. They were just human fodder for the wealthy to clean their homes, to work in their shops, that we could not feel the pain and anguish of our fellow citizens. I have to say, I even now I feel ashamed. I truly feel ashamed. I feel upset. I feel angry that my class of people, the upper classes, could be so cruel and so uncaring about the poor of this country. I don't know whether we'll ever change. I did used to get angry. I used to think, well, we got rid of the British in 1947 and replaced them with rich Indians. In many ways, this is the way the cruelty of India's inequality has played itself out. In many ways, the whole lockdown has exposed the enormous cruelty of inequality and the fact that we don't really have one society that we call India. There are a small slice of wealthy Indians who can only look at their own welfare, and a large number of poor Indians who are basically there to work for them. And that's really the way India is organized. And I do hope if anything happens out of this whole experience of the lockdown is a realization of inequality as being, at the end of the day, the biggest threat to India today. It is inequality. And that as a nation, we need to really aggressively fight inequality. And there are many ways of doing that. Economists are the experts of that field. But I think until we address inequality, not just income inequality, but of course in India we also have the caste system, and that is just an equally profoundly abusive and horrific system. Until we address head-on inequality in our hearts and our minds, we will never progress as a nation.
Definitely. In Nepal, also like COVID-19 exposed the same level of cruelty in terms of class issue and the caste issue also. And we are also struggling in the same way. And Vikram, there is one question from audience, and Jivan Shrestha, he's asking, mental well-being needs to be taught from the children level. How do you think we can incorporate in the school curriculum? I think it's important question.
Yeah, it is. I think that's a good question. It's a great question. And so basically they're called life skills. And they're basically a range of different kind of skills that children and young people should learn, probably just in the same way that you learn other subjects. And in the mental health field, there are a whole range of line skills, for example, problem solving, decision making, emotional regulation. There are curricula for them. Sangath has developed, for example, for problem solving, a game on an app that we should hopefully one day make available publicly on the Google Play Store, which teaches young people in secondary school, adolescents, problem solving skills. So, but you can have life skills that are developmentally designed for very young children, like primary school kids, a separate set of life skills for secondary school kids. For example, in secondary schools, you also want to teach young people how to negotiate romantic relationships. That's a kind of a relevant life skill for when you're 18 years old. But for an 8-year-old, maybe obviously not relevant. 8-year-olds, how do you manage, feeling angry because somebody else in your group, got the prize and you didn't? So those are sorts of life skills that you would teach in school. All right.
Are there any states like who have introduced mental health in their school curriculum?
Yeah. Mental health. So life skills are now run all over India. The mental health component tends to be quite limited, and the quality of the teaching is not that great. In my own experience, the best way to teach life skills is through actually role playing and through actually having peer groups, that actually demonstrate how these life skills are practiced. It should not be converted into some dull subject. Unfortunately, so much education gets converted into dull, didactic learning. You have to memorize things, and even life skills becomes converted into that. But if life skills are properly taught with a teacher who is really engaged, who uses fun and games and exercises and role plays, I believe that they can be very effective interventions.
Okay, thank you, Vikram,
Thank
for your
you,
time
Jagannath.
and the wisdom.
Thank
And
you so
and
much,
I
Jagannath.
always feel inspired to speak to you. And I wish you good health and all the best for you and for your family.